Michigan is the 10th largest state in the country, where you're number 4 in the number of COVID-19 cases. What does that mean to you? What does that say?
I think it says that we all have to take this very seriously. You know, COVID-19 does not discriminate based on state border or party affiliation. And that's precisely why I've been consistently saying we really need to have a national strategy. I am concerned about our allotment from the national stockpile not meeting our needs.
Today, as I'm sure you're well aware, the president tweeted the following: massive amounts of medical supplies, even hospital and medical centers, are being delivered directly to states and hospitals by the federal government. Some have insatiable appetites and are never satisfied. Politics?
I think right now more than ever, we all have to be united fighting COVID-19. We are not one another's enemy. We have got a battle on our hands. This virus has no cure. It has no vaccine. It doesn't discriminate. And frankly, every one of us needs to be spending all of our energy to combat COVID-19.
What have been some of the stories that you've heard and people you've talked to and your citizens that have moved you most in these days?
There are terrible stories. A friend of mine who was in the Michigan legislature, 44 years old, died of suspected COVID-19, wasn't tested, but had all of the hallmarks of it. And I think that this is something that is going to touch every one of our lives. And that's precisely why no one should have time for anything other than trying to fight COVID-19 and save lives. The people that are still working in our grocery stores, keeping the food on the shelves, the janitorial service that comes in and keeps places clean and sanitized, and the teachers that are making sure that our kids are getting food as school is out, but half of our child's population relies on free lunch at school. And so there are superheroes among us.
I know Michigan needs many things, but could you give me a priority list, what you need most of, what's second, what's third, what's fourth?
I would say it's tied for first, N95 masks and test kits. We've got to do robust testing so we know what we're really confronting as a state. And we need N95 masks for our nurses and our doctors and all of the hardworking people on the front line in our hospitals. Every ounce of energy that I have is trying to procure more test kits. We do not have enough test kits. Every decision we're making is based on the best science and best information at hand.
From the White House, in their briefings, we're hearing that supplies by the thousands are going out the door and states and hospitals are getting all that they need. But from governors like yourself, from frontline doctors and nurses, we're hearing desperate calls. How do you explain that discrepancy from what the White House is saying and what you're saying and what people on the front line are saying?
I'm not sure. I can just tell you this. I have talked personally with Vice President Pence on a number of occasions, and I really believe that he understands how dire the situation is. We've talked about it. I know that my fellow governors have had similar conversations with him and found him to be a sympathetic ear and lending a helpful hand. So I'm not quite sure about what is said at press conferences, but I do think that they appreciate the seriousness of the situation. We've gotten some help, and we're grateful for that. We need more.
Point blank, it's clear that you and President Trump are having issues. He's made it clear on a number of occasions he's not impressed by you.
Don't call the woman in Michigan. Well, it doesn't make any difference what happens. Michigan, all she does is she has no idea what's going on, and all she does is say, oh, it's the federal government's fault, and we've taken such great care of Michigan.
How hard does that make your job as governor of a major state in this nation that the President of the United States has taken more than one opportunity to criticize you in a very personal way?
You know what? I don't take anything personally, to be honest. My job is to deliver for the people of the state of Michigan. We have too many people who are getting sick. We have too many people who are dying. I've got to do everything I can to get the help that we need. I'm doing my job. I've never taken pot shots at other politicians. I'm not going to start now. All I can say is this. We are in a dire situation. We need assistance. We need it from the federal government. Every state in the nation is going to confront this at one point or another. We've got to get this right for every American.
Governor, we wish you and your citizens Godspeed. Thank you so very much.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.